great Indian healthcare debate, or rather the showdown, amid all the political back and forth between the centre in Delhi and West Bengal governments. Who has got your back? Let's straight get to business and look at what the three are offering. We are comparing centre's Ayushman Bharat with Delhi's Arogya Kosh and centre's Ayushman Bharat with West Bengal's Swasthya Sathi. Well, first, Ayushman Bharat versus Delhi Arogya Kosh. Health cover. Let's look at first health cover. Ayushman Bharat offers 5 lakh rupee per family per annum. And the Delhi scheme has no upper limit on treatment costs. That's one big difference. No upper limit treatment under the Delhi scheme. Under the centre scheme, you have 5 lakh rupees per family per annum. And then you have a full coverage in the Delhi scheme for all residents, whatsoever. If you look at the Ayushman Bharat in terms of funding, it's 60% versus 40%. That is 60% from the centre and 40% from the state. If you look at the Delhi Arogya Kosh, that's 100% by the state. Eligibility or the target families. Ayushman has approximately 12 crore families covered, bottom 40% of the vulnerable population, and now, of course, all citizens over 70 years of age. Delhi Arogya Kosh, every resident of Delhi is covered under it. Every resident, which is around 2 crores, if you look at the numbers. If you look at the coverage type, Ayushman Bharat goes on to ensure secondary hospitalization, including tertiary care, is provided for. And the Delhi scheme essentially is a comprehensive healthcare, including outpatient services and all treatment types. Then you have the differences which will come up on your screen with respect to a smart card. There's no smart card when it comes to Ayushman, but there is a printout. Beneficiaries do receive a printout. There's for 30 rupees. The Delhi scheme does not mention any smart card whatsoever, no additional charges. And then you'll also have the basis for cashless treatment. Both are cashless treatments. And you have it on your screen of which hospitals you can really benefit it from. Now, let's look at what is it. Centre versus West Bengal, the Ayushman Bharat versus West Bengal's Swasthya Sathi. Health cover. Let's look at health cover. Ayushman Bharat, as I said, gives you 5 lakh rupees per family per annum. Swasthya Sathi, that's the West Bengal scheme, gives you 5 lakh rupees per family per annum. Same funding. Ayushman Bharat is 60% centre, 40% state. West Bengal is 100%, of course, from the state. Eligibility and the target families. Ayushman Bharat, approximately 12 crore families, bottom 40% vulnerable population, all citizens over 70 covered. The West Bengal scheme, over 1.5 crore families, including all eligible families under the Ayushman Bharat. And if you look at the coverage type, Ayushman Bharat offers for secondary hospitalization, including tertiary care. West Bengal is a comprehensive health protection, including outpatient services. Smart cards, again, if you can just, it will be up on your screens. You can look at it. No smart cards versus smart cards being provided on the West Bengal government scheme. And then you have the cashless treatment details also coming up on your scheme, on your screen. So this is largely the big pointers, big differences between what's being offered by the centre-led Ayushman Bharat, as well as the two states that have also been at the centre of this political row, that's West Bengal and Delhi. Now, here's the interesting fact. Look at the top states that are the Ayushman Bharat beneficiaries. Top states. 1. Tamil Nadu, 1/6 of all admissions, 90 lakh plus admissions. Karnataka, 66 lakh admissions. Rajasthan, 57.4 lakh admissions. Kerala, 55 lakh admissions, and all of this is since the inception of the scheme. So just look at the numbers on your screen. This literally goes on to say even opposition rule states have gone ahead and not only opted for the Ayushman Bharat scheme, but literally drawing in from it heavily. The benefits percolating down to the ground. So you have all of this, Tamil Nadu, Karnataka, Rajasthan. When the scheme was launched, it was the opposition ruled state. You have Kerala, all of that. So it's right before you. All right, let me also at this point open this up to my panel. But first, Mr. Indu Bhushan joins us. He is the founding former CEO of Ayushman Bharat, NHA, which is also responsible for Ayushman Bharat. Thank you very much. Thank you so much for joining us. Firstly, a very happy Diwali to you, Mr. Indu Bhushan. My first question, sir, how significant is the expansion of Ayushman Bharat scheme to senior citizens at this point?
Well, adding people who are above 70 is a big step towards universal health coverage, but also big step towards achieving the goals of the scheme. If you recall, the scheme was in place so that no one is denied or no one has to forego treatment because of just cost or financial implications, right? And also to reduce the burden, so no one should be put through the hardship, financial hardship because of treatment or medical expenditure. And elderly actually constitute one of the most vulnerable groups because they live with families in most cases where they're seen as burden, and they're seen when they get sick. Many of the family members don't want to take care of them. And actually, when they get sick, it's also very expensive to treat. So in terms of reducing the catastrophic health expenditure and saving our most vulnerable population, it's a big step. And I think we should applaud that.
Right. I don't intend to ask you this for a political response, but as a former CEO of Ayushman Bharat, in fact, the first CEO, it is a relevant question. How do you look at the back and forth between center and states on the benefits out of the different health schemes, the different models that are being implemented at this point?
Okay, so there are only two states we're talking about who have not joined Ayushman Bharat, Delhi and West Bengal. And both of them have their own schemes. And I have actually told, when I was the CEO, I told this to the CMs of both states that you may have a great scheme, but by joining Ayushman Bharat, it becomes even better. And it becomes better in many ways. One, Ayushman Bharat is a national scheme and it provides portability. So there are a lot of people from West Bengal who are working outside, and people outside will be helped. And there are a lot of people who are coming to West Bengal, so they'll also benefit, and the states, the medical institutions will benefit because they'll provide services there, right? Second is that there is a potential for learning from each other, because we realize that when we are implementing the scheme at national level, we see that there's some innovation happening in Kerala, Himachal Pradesh, Meghalaya, and other states learn from that. So there's that cross fertilization taking place. Third is that there are things that can be done because of economies of scale, because NHA, which is implementing the scheme at the national level, has a very strong AI-based instrument for detecting fraud and abuse. And those kind of techniques and processes can be used by all states if they've joined the Ayushman Bharat.
Okay, no, I will get back to that particular point where you're talking about the AI-led technologies to look at frauds, but key to all of this is also the whole issue of funding, that 60% from the state and 60% from the center and 40% from the state. So in a union federal democracy where the states say, we have a better scheme, we want that implemented, how does this then work? They say, we don't want to bear the cost for what the center is offering.
Well, the thing is that, frankly, both these schemes can improve a lot. And also, both these states can benefit from additional resources. So if I'm doing something already and center is willing to give you 60% of that, why would I forego that. And I've done this presentation to many chief ministers when they were planning to join or not join. And I'd shown the calculations that by not joining, you're foregoing this much money.
But this would also mean that the state scheme would be subsumed under Ayushman as well.
This is not, these are not the only two states which had their own schemes. Many of other states, Telangana and Andhra Pradesh had Arogyashri. Rajasthan had Bhamasha scheme, then Chiranjeevi, and many other states had their own schemes. And they have combined. Even Gujarat had their own scheme. So they have combined with Ayushman Bharat. They've taken best elements of both schemes, and the hybrid scheme actually has turned out to be much better than the original scheme. So that is another thing I think the two chief ministers should do, is see how many states who had their own schemes which were running quite well have benefited by joining Ayushman Bharat.
Okay, last question. You spoke about how AI and other technologies could be used to detect frauds and so on and so forth. But what about the CAG report, the CAG report, which did raise big concerns of fake beneficiaries, among others?
So all of these have been actually very thoroughly been addressed, all these issues. And most of these issues actually pertain to when the new scheme is put in place, there has to be constant review and upgrading, and there are some glitches which need to be addressed. For example, CAG report mentioned that in many cases, the phone number was 99999, 10 nines. And the problem was that in the first version of our IT platform, if there was no phone number with the beneficiaries, and many beneficiaries didn't have phone numbers, the default was 10 nines. And of course, we had that and we changed that within 6 months. So, this is a scheme which was put in place on 23rd of September 2018. And within 6 months' time, there were millions of treatments done.
Right. Thank you very much, Mr. Indu Bhushan. Thank you so much for joining us and for your time. Moving on, let me also introduce my other panelists. Dr. Sanjeev Bagai joins us, Nephron chairperson, Mukesh Tyagi, leader for BJP, Tausif Ahmed Khan, lawyer and political analyst, Syed Asad Abbas, who's a political analyst as well. Thank you very much, all four of you, for joining us. Happy Diwali to all of you, but it's quite a bit of a back and forth between center and states this time. At the center of it all are also senior citizens. So it's going to be a Diwali that many will have to decode what they are up for. Let me just straight come to you at this point, Mukesh Tyagi. Mukesh Tyagi, what do you expect out of states? Prime Minister has apologized to senior citizens in West Bengal and Aam Aadmi Party in Delhi. Prime Minister has said they are not going to get the benefits because the states are getting that. But we just did a comparison. If there is a state that is offering no cutoff limit whatsoever to the amount that's going to be covered, to the cost that's going to be covered, what's wrong with it? Why do they need to? There's another alternate that's already available in those states.
I think it is far more complex. Let me first wish all of you happy Diwali. And right now I'm in the middle of some noisy environment. But I think Prime Minister has given a bonanza to 70-year plus to pan-India people. Now he's only saying he's apologizing because two states, West Bengal and Delhi, are like obstructionists. And you will be surprised to hear that West Bengal had once opted for this Ayushman Bharat scheme, and then later on they withdrew. So there are political overtones. You know, it is not a comparison that you will do apple to apple or oranges to oranges. You have to see the enforceability, you have to see the corruption, you have to see the pilferage. You have seen Mamata Banerjee's reverence for the medical health in RG hospital. That kind of reverence they have. And Mohalla clinic full of scams. 65,000 sample tests were done, which were fake. And then the doctors were recording the fake attendance. So there is a huge implementation. Out of 500, 300 Mohalla clinics were not working. The medicines they were prescribing across the board to all the patients, irrespective of what ailments they had. Then medicines were being pilfered out, sold out. There was no camera. Even camera was there, it was not functioning. So I think, and look at the size. What Prime Minister Modi is addressing, it's a pan-India, 140 crore people. You see, my fundamental question is, even let us assume, let us not compare the two schemes, which is again not a very scientific comparison as a matter of fact, because you have to see holistically what is the problem with the West Bengal government or Delhi government to provide add-on, because it's a pure political. They don't want Mr. Modi, whose relentless contribution to the country on the health front is so exemplary, whether it's a COVID, 200 crores people were giving the COVID injection, worldwide they supplied the COVID. Swachh Bharat, where the open defecation was the rule, he constructed toilets for those ladies. So Mr. Modi's entire vision
get where
for
you're
the
saying, but let's
country
just stick to this
is
issue. It'll be so much more easier for viewers to comprehend what's being discussed.
What I'm saying is, look at today's 70, it's a value addition going on. Like you had a CEO whose statistics I've seen that 6,500 crore was the budget and 16,000 crore was the saving. Another handicap is the Delhi patient, suppose he's migrated to some other part of the country, northeast or somewhere else, so he will have to come back to Delhi for his treatment. Similarly in the West Bengal. So what is happening is the pan-India application of all the beneficiaries of Ayushman Bharat can go anywhere in the country and get the treatment. And because there are a number of hospitals, AIMS, where central government is monitoring and funding them. So, you know, NK Singh, 1 second, I'll just finish. NK Singh said why it is on the state list.
All right, let me just get in others to respond to what you're saying. Let me just get in others. I've given you considerable time because you also have two from the opposition rule state, so I gave you considerably more time as well. Syed Asad Abbas, let me come to you first. Syed Asad Abbas, of course, there's a lot between the Aam Aadmi Party government as well as the centre between the central government. There's a lot. It's an open Pandora's box. Every now and then something comes in. But why have a showdown over health benefits? Why can't the two work together around it?
Well, Sneha ji, what you've said is absolutely right. As a matter of fact, I've always believed if there's great responsibility, there must be equal accountability. No doubt about it. The fact of the matter, the same reason why former United Nations Secretary General Kofi Annan, highly appreciated among the world, the global news of the Delhi model in the health sector. Not just that, let me address this point. Many of the patients that you find at GP Pant government hospital here in Delhi are actually many people from the Uttar Pradesh, Haryana, Madhya Pradesh, and other BJP ruled states. If the BJP ruled states Ayushman Bharat is such a beautiful, wonderful scheme, why are many of the patients there? Why, I tell you, the Delhi government hospitals are able to provide operations from rupees 5 to even to a rupees crore. Several patients across the length and breadth, as a matter of fact, traveling 300 kilometers. There is an official statement of the same by the Delhi Health Minister, Shri Saurabh Bharadwaj ji. The fact of the matter, yes, Sneha ji, I completely agree with you on the front when it comes to the matters of health. All the states need to come together. All the respective chief minister along with the center need to come together. But the Bharatiya Janata Party and our Honorable Prime Minister Modi ji need to understand and look at the Comptroller and Auditor General of India's report. And the report has clearly stated of 27,000 hospitals, 7,000 hospitals are only on paper, out of which 4,000 have found to be irrelevant. Not just that, what about the fake beneficiaries? So therefore, to me as a citizen of this beautiful country, I have my own questions on the Ayushman Bharat. So therefore, yes, there will be questions which need to be answered.
No, here's the thing, Syed Asad Abbas, and I will go to Mukesh Tyagi for a response on that. I also have a question for him. But Tausif Ahmed Khan, There's not been a CAG report. There's not been a CAG probe on the Delhi scheme. There's not been any CAG probe. So how do you know whether there'll be something or not? There was a CAG probe that came out. Well, the CEO says it's been fixed. Why not figure it out whether it's been fixed or not?
Well, if there needs to be any of the comptroller audit generals, any audit,
No,
as a
whether
matter of fact, I'm sure the Delhi government is
CAG
confident and they
report or
will
not,
welcome it. The Delhi
CAG
government will
report or
certainly
not.
welcome the same and they will look forward to it. As a
No,
matter of fact,
Tausif, I'm
I
sorry.
believe.
Tausif, give me just a minute. Let's Syed
I
Asad
thought
Abbas
the question
respond. Just a
was
minute.
As a matter of fact, you've asked a very important question, Snehaji. Certainly, let there be a CAG probe on every state and chief minister of this country. When it comes to the matter of health, it needs to be prima facie most important for every state there, so that under every criteria and eligibility, be it the families, be it the children, or even
But
senior
there were
citizens,
questions on the Mohalla
must be
clinics as
covered.
well. There were questions, there were
Absolutely.
findings. There were findings against the Mohalla clinics as well.
Yes, certainly there are findings, and many a times the health minister, Shri Saurabh Bharadwaj, and previously, years back when it was Satyendra Jain ji, he did welcome them. And he did take the feedback and the respective corrections were made so that the best of health is provided
Well, that's what
to
the centre is
every
also saying in
citizen
this.
of
But
Delhi.
Mukesh Tyagi, very quickly, let's just get the Delhi versus the centre graphics up on our screen, please. 5 lakhs per family cover. 5 lakhs rupees per family per annum is the cover, health cover that the centre is offering. The Delhi
Absolutely.
scheme, there is no upper limit on treatment costs and there is a
Yes.
full coverage for all residents. Mukesh Tyagi, why should anybody opt anything from the centre on this particular scheme? I mean, given at the face
Absolutely.
of it, look at the big difference. Mukesh Tyagi, very quickly.
Acha, tell me one thing. Why is the predominant number of the states have adhered to their Congress-ruled states? Why they've adhered to Ayushman Bharat scheme? So there are certainly, they see the positivity in that. It's not a political question at all. It's a Mamata Banerjee and
Certainly,
Kejriwal
my question
who
is
has
about one
rid
very
Delhi
specific thing,
with
Mr.
his all
Mukesh
kinds of
Tyagi.
swindling.
My question is about what's being covered. 5 lakh rupees per annum to a no limit. A very straight question which any viewer would want to know.
What? I am only saying what is wrong in combining and making it a hybrid health augmentation policy. Why Delhi is opposing to it? So everybody will be given an option. Either they can switch over to Ayushman Bharat or they can go to Mohalla clinics or they can go for combined. So why can't you expand the options before the people? You know how this country is suffering from number of malfunctioning, malaria. What has Aam Party has done for the dengue? I mean, look at the epidemic of dengue in Delhi. Look at the epidemic of pollution. I mean, just winter has set in. You are providing a chimney and smoke to the Delhi people and you're talking about the health. Your health standard is so dwindling and so derogatory in nature. You have no business to talk about Ayushman Bharat because I'm not saying that you discontinue your scheme.
I think,
but why
let me
can't
just
you
get
allow
in Tausif Ahmed because...
scheme to come?
Because if you go into that rhetoric, this discussion is going to go nowhere, but you have a right to respond, Abbas. Please, very quickly, 30 seconds. I have to go to Tausif Ahmed after this.
Thank you, Snehaji. Appreciate the time. 30 seconds
not more
I
than
will
that.
answer this. Yes, 30 seconds I will answer. Thank you, Snehaji. The fact of the matter, Mukesh Tyagi ji, you've raised a question. But let me tell you, sir, an answer is the answer you need to give to a question, not to ask a question on a question. The fact you need to, I welcome you, sir. Please come to the GTB Government Hospital. Please come to GP Punt Road Hospital and see there. Today's generation, today's world, sir, a 5 lakh cover for a family is not enough. You rush into a hospital, it won't be billed less than 1 lakh to you for any surgery. The fact you need to understand, you cannot cap it at 5 lakhs.
Point made. Allow me to go to Tausif Ahmed Khan at this point. All right. Okay, allow me to go to Tausif Ahmed Khan. Tausif Ahmed Khan, thank you very much for your patience.
Consecutively.
No, hold it, please. To the panelists, Tausif Ahmed Khan. Tausif Ahmed Khan, my question is really simple. And here's what Mukesh Tyagi makes an argument. Here's what the former CEO of Ayushman Bharat also said. And here's a question which every viewer will ask. If you are offering something better to the people in West Bengal, why not give it as an option from what the centre is offering and what the state is offering and see who takes what? What's wrong with that?
No, you see, because what centre is offering is a bogus scheme. The application, the eligibility criteria and the coverage is all bogus. Only 60% cost is covered by the centre.
Okay, tell me
the
why is it
beneficiary
bogus?
has
Tell
to,
me why is it bogus, Tausif? Can you
make
give
a
us few points?
contribution if they wish to avail. Why? I'm saying before Ayushman scheme was launched, Mamata Banerjee had already introduced the Swasthya Sathi scheme. Swasthya Sathi scheme at present has about 2.4 crores, more than 2.4 crores families covered, more than 2,400 hospitals are empaneled, and more than 76 lakhs people have been hospitalized, and more than 98.2% claims have been settled. That is the ease with which this scheme functions. It is so easy to get enrolled. Any permanent resident of West Bengal can enroll for this scheme. He will be issued a smart card free of cost. You just go online, Google Swasthya Sathi scheme. It will take you to a page where you can enroll and register yourself. And you go to any hospital, show the card, and you get a cashless treatment, pre-approved. The cost of the treatment is pre-approved by the Swasthya Sathi within 24 hours, and that is guaranteed. Not a single penny the beneficiary or the patient party has to pay if they are using the Swasthya Sathi scheme.
Okay.
Now contrast it with the Ayushman Bharat. What is Ayushman Bharat offering?
Okay, Tausif, Mukesh Tyagi went on to say that this is politicking. Mamata Banerjee first said that she will be joining Ayushman Bharat, and then she said she will not, and she rolled out her own scheme. Now, my question is this, Mukesh Tyagi, let's just get the graphics on the states that are the maximum beneficiaries of Ayushman Bharat. Look at the states. If we can get that graphic up, you have Tamil Nadu, you have Karnataka, you have Rajasthan, you have Kerala. In fact, even when Rajasthan joined it, it was an opposition ruled state. So if you have those states, and if there is a hybrid model that's functioning, this is the question. Why can't West Bengal go with a hybrid model? Is there weightage in what BJP is claiming that this is politicking?
It's all the negotiation with the insurance company. What has the center negotiated? Does the center scheme allow that? Does the state scheme allow that? It is only one scheme that the resident of Bengal can enroll and avail this facility, which is fully funded, 100% funded by the state government. Now, with the Ayushman scheme, there are so many checks and balance which does not really help the cause. The number of beneficiaries who can avail the scheme under Swasthya Sathi scheme is much larger than the Ayushman scheme. Kindly ask the representative for the BJP to enlighten the people on that.
No, I was asked to talk. I am enlightening you. What is West Bengal is doing? They are converting all the medical centers into the rape and murder. This is the situation. All the doctors on the road. Look at the kind of lengthy agitation.
What nonsense is this gentleman saying?
For the
you have lost the plot.
People are dying on the road.
Talk on the scheme. You have lost the plot.
Is it not?
Only propaganda. Only propaganda. Which world do you live in? Only propaganda, lies and falsehood.
Mukesh Tyagi,
propaganda, lies and falsehood. That is what BJP is.
Listen, what Tausif Ahmed is saying at this point is, Mukesh Tyagi, what Tausif Ahmed is saying at this point is this, that listen, the whole process for Ayushman Bharat is extremely cumbersome. The coverage that it gives, the beneficiaries that can be covered under it is nothing in comparison to what West Bengal offers. What do you have to say to that?
I think it's a very preposterous argument. Look at the scale of the implementation of Ayushman Bharat and look at the implementation of the beneficiaries, number of beneficiaries and other schemes. It's a much more complex, but let me also correct it. Today you can draw your Ayushman Bharat card on the basis of your Aadhaar and you can download it from your computer. You don't have to go and stand in a queue to get it. Number two, look at the pan-India digitization. Today, any lapse happen across the country, it will be reported on the central panel and immediate corrective measures will be taken. So you just read it, now Aadhaar card base, you can always draw your Ayushman Bharat card. You will always criticize something what you do. You first save your own state from medical catastrophe. Which
Okay,
you
wait
guys
a minute.
have
I
introduced.
have to go to
All the
Sanjeev
doctors
Bagai,
of
but
this
I'll
country
give you
were
30
attached.
seconds, both of you.
Claims are settled.
Let me just do a 1-point comparison between Ayushman as well as the Swasthya Sathi of the West Bengal. There's 1 point, and that's a coverage types particularly. Let's look at it. Ayushman Bharat provides for secondary hospitalization, including tertiary care. Swasthya Sathi claims comprehensive health protection, including outpatient services. Mukesh Tyagi.
No, there's a tertiary care in Ayushman Bharat also, and there is a complete penetration. Look at the penetration what BJP government has done in terms of primary health
But do you
centers,
have
All India Institute
outpatient
of
care?
Medical Sciences.
Do you have
in nook and
outpatient
corner. Look at
services
the
included in
expansion.
Ayushman Bharat? To my best knowledge, it is not.
OPD is not there.
Whereas Delhi and West Bengal both offer that.
You see, no, you see why I'm asking you, if this scheme is so unpopular, why the Congress-ruled states are continuing? I mean, there is a gravitas in this scheme. There is a honest implementation. It's unlike medicines being pilfered, stolen. Fake medicines have been introduced into the system. Out of 500, 300 Mohalla clinics don't function. Doctors give a fake attendance. There is an absence of doctors. Look at the condition of all these Mohalla clinics, and less said about West Bengal. I think I think Prime Minister Modi's intention and implementation on the health scheme is absolutely tremendous, because that is consistently
No, nobody's
shown
questioning.
in his
Nobody's
performance,
questioning
whether it's
intention
a
here.
COVID,
Nobody's
whether
questioning
it's
the intention
so
about these schemes. Nobody's questioning. I know Tausif as well as Asad, both of you would want to speak on this, but allow me to go to Mr. Bagai. Dr. Bagai has been waiting very patiently. Let me go to him, please. Dr. Bagai, firstly, happy Diwali. Secondly, thank you very much for your patience. My first question to you, as a medical practitioner,
Same to you.
as a health specialist, when you look at these schemes and the back and forth between the centers and the states, as somebody who's running hospital, who's running these healthcare services, how do you look at these?
Good evening, happy Diwali to everyone. And I think being in healthcare for more than 40 years now, what it has taught me the most is to be patient. So I've been listening to everyone very patiently. Diving straight into the topic, I think insurance is a very complex topic. Patients go to get the medical services, to avail of treatment. It's primarily which is doctor-driven. It's facility-driven. It is infrastructure-driven. It depends upon what specialty treatment is available where. My take is as follows. No insurance scheme in any part of the world is 100% perfect. The center can learn from the states and evolve the Ayushman Bharat, and likewise the states can learn from the center. There should be an integrated model. The model must cover OPD and IPD and other ancillary facilities, which includes ophthalmology, ENT and dental, which most even private insurance companies fail to cover. It has to cover the antenatal care, genetic causes, chromosomal causes. The important point here in India is, and we've learned through COVID, no one is safe till everyone is safe. Interportability is very important. A same unified national card must be applicable in J&K down to Tamil Nadu, Gujarat down to the northeast states. We will not be successful in healthcare if we have regional-wise demarcation. Whatever are the gaps in Ayushman Bharat, the system will evolve. And I think we can learn from Delhi, we can learn from West Bengal, we can learn from Karnataka or any other state, away from politics. But the scheme must be unified so that the penetration is the maximum. The last important point is the new gold in healthcare is data. Unless until we don't analyze the data, we can't go into predictive mode of medicine. We can't use technology, we can't use AI, we can't use precision medicine. We must capture the data from every state because the disease profile, epidemiological profiles, the kind of clinical cases we see in different parts of the country are different. So my take is a unified integrated model works well. We should go beyond political lines. We should integrate what are the gaps in a central scheme. We can definitely learn from West Bengal. If they have done something which Ayushman has overlooked, there is no harm in implementing it so that the unified national scheme becomes stronger and better. In the end, I would like to say, before the Ayushman came in, the healthcare penetration in India was just 4%. This scheme is covering 50 crore people, which is about 40% of Indian population. It's a good scheme. It's the largest insurance scheme. So I think all the political leaders should sit together and help us as doctors so that we can deliver the best possible medical care. My take is two: data and interportability. A same patient from West Bengal should be able to avail the same facility if he is traveling to Rajasthan and elsewhere. Over to you.
I think very fair points. I'll go to all three panelists to respond. But Mr. Bagai, very quick, Dr. Bagai, very quickly, one more question, and I'll possibly give you a minute and a half to respond to this. I remember when initially the ECHS, not initially actually, till very recently at least, ECHS and even the central scheme for that matter, hospitals would opt out of it. They would say, we are not getting the money. It's cumbersome. There's a huge backlog. You know, there used to be this whole issue between the hospitals that are empaneled and so on and so forth. Is it any better with these schemes vis-a-vis, whether it be the center or the states? Is it any better today?
You put me in a very tight spot. So let me put, just allow me 1 minute, because this is more than a medical but an emotional topic.
Please.
If any person who wants to practice medicine and sacrifice 15 years of his youth coming into practice is doing this for earning pots full of money, they are in the wrong profession. But doctors cannot be the common chronic flogging horse of everything else going wrong in the country. Blame it on the doctors. What is important is that the doctors should be paid fairly. The pay scale rates of ECHS, CGHS, ESI and other models are very, very low. That's why most of the private sector hesitate to take those load on. It's about 1/5 of a routine private consultation or a routine private surgery. So I think we need to relook at the rates. I'm very much against profitability which harms the patient. But the doctor should be paid fairly. The delayed payments should not happen. Staggered and cut payments should not happen. The medical professionals must be safeguarded. We are still lacking 1 million doctors in India, more than 1.5 million hospital beds in India. Doctors should not become as extinct as Jurassic Park dinosaurs. We need to look after the healthcare. Therefore, I still request, in the end, all the states should come together. Haven't we learnt enough from COVID? Haven't we suffered so much in COVID? There is not a single person, either on this panel or elsewhere, who's not lost some near and dear one, either in the immediate family or the friend circle or the relative circle. Data is important. We have to learn what's happening in northeast states and learn the disease profiles from them, from the southern states and so on. India is one. Healthcare is one. It's more important than the defense ministry. Health ministry is supreme.
Right. Dr. Bagai, some very important points. A minute each to all of our panelists. I'm running short on time, so there's literally going to be a timer on all three of you. Let's start with you, Mr. Tyagi. Big questions raised by Mr. Bagai. Are you willing to learn from states? Are you open to them? Are you willing to treat them as equal partners? Because several opposition rule states have raised that concern that you are not treating them as equals.
Absolutely, it's a folly of argument. I agree with Dr. Very important issues. It should be portable scheme, it should be pan-India scheme, and let the patient or beneficiary have the option which scheme they want to offer. But it is because of the political consideration, Mamata Banerjee and Kejriwal are opposing Mr. Modi, because Delhi is going to have election and the malfunctioning is known to the people, and they know once Ayushman scheme enters into their state, it will outsmart their scheme. And let me also tell you, the Delhi, I think if I remember, Delhi Mohalla clinic upper limit is 2 lakh. I'm not talking about the OPDs. So what I'm trying to say is R is 5 lakh. So there is a substantial difference there. So we have a very robust policy which has been welcomed by the country. You don't see any criticism from any quarters. Show me one patient who has suffered in the hands of So every family is getting the support at the doorstep. Today it is getting modernized with the telemedicines, with the number of cards they are going to get it. Look at the cost of the medicine. Jan Aushadhalaya,
Okay.
where the cost of the medicines have
all
been
right.
brought
Time up, sir.
on the basis of the generic measure. So there is a holistic, yeah.
Syed Asad Abbas.
I think it's very important to take responsibility. Also, as a matter of fact, yes, I've been a part of the panel on several debates during the COVID time with Dr. Bagai, and it's been always a pleasure to listen to the man. The fact is, I completely agree with you, gentlemen, that all the respective political parties, the chief minister, the health concerned officials need to come together. For the same reason why the Bharatiya Janata Party introducing Ayushman Bharat scheme needs to take a leeway from the Delhi government models, which has absolutely no cover, sir. Even surgeries up to 1 crore are done absolutely free. The fact of the matter, we need to understand that today's modern day and age, a cover of 5 lakh for a family is certainly not enough. That is something the central government needs to take down from Delhi.
So a hybrid integrated model can be worked out, can't it be? I mean, there
Of
are states
course.
that are doing that. Even if yours is a better, a hybrid integrated model can be worked out between the two.
Precisely my
And
point,
certainly
Sneha ji.
having a no cover limit is great.
Precisely my point, Snehaji. Not just that, when there is a trust deficit which comes in to me as a citizen of this country, when I look at the CAG report, that needs to be notified. And those found guilty must be punished because there are bogus numbers, fake beneficiaries. Not just
Okay,
that.
I don't have more
Snehaji, 10
time, but
seconds. Not just that.
Syed
Also,
Asad Abbas, there's also questions which have been raised with the functioning of these clinics on the ground level. But nonetheless, that's not the course of discussion for us. Very quickly, Tausif Ahmed Khan, please.
Look, center has had this step motherly treatment with West Bengal because they have failed to release the state government dues in so many other welfare schemes. And similarly, they have not taken the good, the goodness from the Swasthya Sathi scheme and integrated in the Ayushman scheme. For example, like outpatient treatments are not covered. Secondly, the in Swasthya Sathi scheme, it covers a whole lot of family members, including the parents of both the spouse, which is not available with the Ayushman scheme. So there are so many. One more pointer is that it is only 60% funded by the center. Why not fund it wholly, 100%, just like state government is doing, so that the patient party does not end up paying rest of the
Mr. Tyagi, very quickly respond to that.
Pocket.
Very quickly, Mr. Tyagi, respond to that.
The limit is only 5
If the
lakh.
center
Why
is so
not
passionate
whole
about
sum?
Ayushman, Ayushman scheme, and the states are not cooperating with that,
Shreya,
why not just go all out?
It's an oxymoron argument. If 60% is being contributed by the center, at least it will take away the 100% burden on their localized scheme. And yes, improvements can be always done. There is we are open to the idea of improvement, but as long as it's not political in nature. Mamata Banerjee and Kejriwal are all politically motivated. There is no meritocracy they see into any of this scheme.
That can be
They're
said
only
the same
trying to
about
make
All
the
right.
political
Between
mileage
all
out
of this
it
back
till
and forth,
they
Dr. Bagai, let me just come to you very quickly
we are
again.
not.
Dr. Bagai, my last question to you, and I think I'll have to end this discussion
not
with
only
that. Dr.
political
Bagai,
adversary, elected chief minister.
to the viewers who are watching, the burden of the care, particularly for the elderly, is a challenge in India. Bulk of India's population is an aging population. Just how importantly, closely, realistically, must families and the senior citizens follow the discourse and these schemes that are being offered, particularly if we are looking at the urban population, the urban middle class, upper middle class population? How should they be approaching this? Because they do have the insurance cover. But still, how significantly must they be watching this closely? A minute, Dr. Bagai.
I think health is the most important. Health is the most important key for livelihood and life itself. And I think this begins right from early childhood and adolescent. So I think public awareness campaigns, education of the masses is very important. Lifestyle diseases need to be paid a huge focus on. Non-communicable diseases are contributing more than 60% of the disease burden, not only in India but worldwide. More importantly, an added cover to cover the geriatric age group, not only 70 but 80 and 90 above are important. Diseases, especially of cancer, cardiac, neurological, and other miscellaneous which are affecting the elderly age group are extremely costly. Health insurance, especially for people who can afford, they must get their health insurance done. It's a cliche that you can't drive a car or a vehicle, even a two-wheeler, out from the showroom on an ex-showroom price unless until you don't get a comprehensive insurance, third-party insurance. You can take a newborn out of the hospital with no insurance cover. That's ridiculous. We have to look at our own health. We have to look at our own preventive measures. We have to think as a country and as one unified body. All states come together to make Ayushman Bharat or indeed an individual scheme the most successful scheme in the world. It is possible. We just have to sit together on the table, put patient first, politics second. For us as doctors, patient life is the most valuable.
All right. I think we're totally out of time. Dr. Bagai, patients first, politics second. I think that's the best note to end this show on. Dr. Sanjeev Bagai, Mukesh, Tyagi, Tausif Ahmed Khan, as well as Syed Asad Abbas. Thank you very much for joining us.